we're going to take on the next 30 minutes, just getting to know your thoughts, your feelings about the school year, what's worked, what could be better, what could be doing to support you. So before we get started, I'm going to introduce myself. My name is Vicki Ingalls. I'm with Charleston Promise Neighborhood, Director of Programs. If you're not familiar with Charleston Promise Neighborhood, we have been a partner with Mary Ford, Shakur, James and Sanders Clark for the last 10 plus years. I've been with the organization since January 2011, pretty much from the beginning. We started with a direct understanding that we had opportunities to partner with our school districts. Obviously, school budgets are not what they are these days. There's opportunity, our teachers, our parents, our community wants to support our families, and so we have focused on a couple areas of community engagement, ways that we can bring our residents around the table. Here from our neighborhood associations, we've got great participation from Academy, Shakur, Cherokee, Eastside, and other communities here. We have a peer advisory council this year, which is an opportunity for you all to participate. We need more parent voices. We want to know what's working, what could we be doing better, what supports are we looking for. As we look at our plans for the next school year, we want to hear what those things could look like. We also have a wonderful partnership with WSC. Anybody have a child that's participated in the Kids Well School-Based Health Program? It's been going on for, again, 10 years. It's basically the satellite doctor's office. This year's been a little different because of COVID. We can't do quite the number of school visits, 6 visits, but we do have the ability to see children both in school and at home. Just show of hands, anybody have their child go to the school-based health clinic this year that you're aware of? Enroll? Okay, so this is an opportunity to learn more about that. We have a brochure in here. We are kind of toward the end of the school year, and there are going to be some potential changes for how school-based health could work next year. We are looking at Better Healthcare Network as a medical home. If some of you know about Better Healthcare Network, they also offer wonderful services to not only children but also the family. And they have mobile vans and dental and mental health, family counseling, OBGYN. So these are the kinds of services that can be brought school-based, but then you will be introduced to them, and if it's a good fit for your family, it's a great way for your entire family to be identified as a better home for them. So that's some of the things that we're going to be focusing on in the next couple of days here, years, months, hopefully, as we go forward. So, just kind of looking back at the school year. It's been a tough year. I want to acknowledge all of you because it's not what anybody expected. Here we are, April 2021, and a year ago we were still in the beginning throes of what COVID was and what it was going to do to our family, our community, and our schools. And so you made it through. Thanks to your hard work, getting your kids ready every day, getting them out the door, getting them masked up, ready to go. Just pat yourself on the back and congratulations. Because it's not a small achievement. And I want to thank Ms. Taylor, her staff, her teachers. They worked so hard this year to provide the best structured environment for learning despite challenges. I know your teachers have worked 120% this year for you. They have. So, but we're looking back now at the remaining 6 weeks. We've got 6 weeks left. We want to be able to just talk a little bit more, reflect on what this year has been like for you all. And we have kind of a little structured activity that we have set up to be about 15, 20 minutes. We're going to just kind of get into it. We've got 4 questions. We want to just hear from you. So let's get started. In front of you, you should have an agenda. And if you don't have the agenda, please raise your hand. We've had a couple people moving around a bit. We want to make sure you all have the agenda because the 4 questions that we're going to be talking through are listed there. Everybody should have index cards. Everybody should have a pen. If you don't, please raise your hand and we'll bring them to you. So the first question we want to reflect on is, what worked for you this year? What was good about this year from a school perspective? Was it the teacher communication? Was it the learning environment that Ms. Mary Ford and Ms. Taylor brought to you all this year that was different than last year? Just the top 3 to 5 things that come to mind when you think about what worked for you this school And if you can just write those down on the first index card, give you a few minutes, and then we're going to invite you all to share out some of your thoughts. So just to clarify, we're just asking you to reflect on the past current school year that we're in, and what worked for you this year? What was good about the school year? Just thinking about your child experience, your interaction with Mary Ford, the teachers, the staff, whatever comes to mind. So, like most folks have written something down at this point. I would love to hear somebody who would like to just share one of the things that they wrote down on their paper. Start back here.
The dojo app.
The dojo app. Okay. So that was the way the classroom teacher communicated with you all on a regular basis. It was basically like a classroom page, if I understand it. Okay. Wonderful.
My children were no longer virtual.
That was the best thing. Right. And we're going to be collecting these cards, so you don't have to worry too much here. I'm just trying to get some ideas that we can share in the room here.
They flew around with open arms when they wanted, so that was added.
Okay. So Mary Ford is a very welcoming environment. I think we hear that over and over again. And I think that Ms. Taylor and your team, again, it's a special place. Anybody else want to share a reflection? Yes.
Ms. Washington was very nice and always texted me and let me know what was going on upcoming in school. So she was very helpful this school year for me and children.
So Ms. Rachel Washington is the parent advocate. I know she works really hard to stay in touch and communicate with parents, and whether that's texting, calling, emailing. I know she works hard. I talk to her a lot at 7:30 at night. She's always on. Anybody else want to share?
For me, it was the communication with the parents and the teachers. There was never a time where I came to the school and addressed the situation and it wasn't resolved promptly and effectively. So that was a major thing for me. My daughter transferred from one school to another. The response with the teachers and the principals was amazing. So,
That's important.
yeah.
To feel heard and listened to. Yes. Anybody else have something to share?
So I don't really have much to share from last year because it's a new experience for me. My kids just started school in January, but I do want to say that Ms. Frazier and Ms. Ritter was very welcoming. Ms. Ritter, she challenged Ms. Christian, and my other son will be starting in August, and he's going to be the fourth generation. So their dad will be married for his dad, and now my kids are married for.
I think this is amazing. This really is a neighborhood school, and we talked to a lot of folks, and this is the second, third, fourth generation who have come through these doors, and so it's good to see that legacy here. Anybody else have a comment before we move on to the next question? We're good? Okay. And if you could just keep those cards at your table, I'll be collecting them at the end, so you can just put them aside. Now the next question is, what could be better? We always know there's room for improvement. So again, the top 3 to 5 things and another card, separate card. Please write down 3 to 5 things that come to mind when you think about what could be better. Okay, I'm going to go ahead and hear from some of you. The question is, what could be better? So, always space to identify where you can do things differently, where we can make some improvements. Anybody want to share one of their comments? This is a harder one sometimes. It's a little more open to vulnerability, right?
I actually don't have any complaints at the only thing is my kids are in after school. I get off at 5, so I'm like looking at a chicken with my head trying to get over. But other than that, I'm good. I'm good.
Okay, so your child is in the after-school program. Wonderful. And that's one thing I failed to mention earlier. That has been one of our signature programs here for the last 5-6 years in the after-school program. And summer programs too, which we'll be talking about a little bit, because there's a lot of wheels in motion with summer this year because of just the nature of our school year. Anybody else want to share?
Basically, when, like report cards, I have 2 different children, 2 different classes. So with my son kindergarten class, I'll get 2 different report cards. Sometimes I need more clarity on it, and sometimes I know it's hard to do upfront conferences, but maybe voice or virtual conferences, just to pinpoint exactly where it is, because I got one report card and it was great. Then the other one, I didn't even understand where the levels were at. So just basically, if you feel that your child needs more work or more help, call or let the parent know exactly where they are, because I was kind of confused on his report cards on this level where he was at. Other than that,
Yeah, I know typically the first report cards are in school meetings, and I know that couldn't happen this year, but I think to address the opportunity there, that's definitely some good feedback. Thank you. Anybody else in this row? Back here? Okay.
I have a daughter that goes to Government Elementary, and at the beginning of the year, they took pictures, and at the end of the year, they just took pictures. And my daughter here, she hasn't taken any pictures yet. I think, more pictures throughout the year.
So the class pictures and individual pictures, did you all do that this year?
We might get our own pictures in-house and families will be sending them either around Mother's Day or at the end of the year. But he's talking about before when the studio comes in and takes pictures. No, we have not done that for COVID reasons. We're going to be talking about it.
Okay, anybody on this side of the room want to share anything that they've reflected on for what could be better? Yes, sir.
I think we just want you to present about something.
Have this for more local school. And like I said before, activities for the kids, join their talents and whatever. But we know the boys, what's going on right now, so it's going to do all, things like that. More activities.
So what I heard you say is more activities, ways to showcase student talent?
Right.
Okay, it's a great one. Anybody else in the back row here? No? Okay, move on. Again, please put your cards to the side and we'll collect those a little bit later. So the third question is really about summer programs. Are you planning to have your child attend a summer program at Mary Ford? If not, what are your summer plans? And I think before you answer that question, it would be helpful to have Ms. Taylor and Ms. Parr talk a little bit about the status of summer programs, because things are, of course, moving with how things can be planned out this year. So I'll let Ms. Parr talk a little bit about summer program planning that's in process.
Good morning. We're in the process, I'm Ms. Hart, assistant principal here, and we're in the process of recruiting for our summer program. CCSD also has a summer program that they're recruiting for as well, so we had to wait until their program was filled or almost filled before we could begin our process. So on Monday, you should be getting an application. If it's something like this explaining the process, our program is 5 weeks, and we will be going from June 21st until July 23rd. Okay, and it will be right here at Mary Ford. There will be bus transportation only if your child is in K4 or K5. The program will have 3-year-olds in the program, but they will not be allowed to ride the bus. So there'll have to be a drop off and pick up by the parent. So that's very important, because if you have a 4-year-old here, I'm sorry, go ahead.
I just wanted to ask a question, do they have to be a current 4K or if they're going to 4K and already
Current.
they want to be eligible for a summer program?
Current 4K.
Okay.
So that's very important, because I know some parents have 2 students, one here and one over there. But if your child is currently over in the living cottages, they still have to be picked up and dropped off, okay? But you can have bus transportation here if your child is 5 or currently in the kindergarten or currently in the 4-year program. Also, there will be snack and breakfast provided, and there will be some enrichment in the afternoon. But the morning part will be academic. I'm trying to fill in the gaps, from the COVID environment. Any questions for me? Again, this will be coming home on Monday, so make sure you look for it in your child's folder. You have until the 14th to return it, but the quicker we can get it in, we would like to have our numbers. The time is from 7:30 to 6, so it's an all-day program, so if you need it all day, it's here all day.
Ms. Hart, more questions, please?
Is there a fee for it?
No fee. It is free to all of our students. Yes, special needs students will be accepted. It's everyone that attends Mary Ford our learning centers.
Is there a max number?
80. 80 is our max number because of the COVID environment. So that's why it's important to get your application in. It's on first come, first served basis.
You mentioned breakfast and snack is also one thing that happens.
Yes. So we're here to support you. If you have any suggestions or if you want to know any more about the program, again, my email, phone number is on here. Ms. Trish Anderson, who is the program specialist over in the learning cottages, her name is on here. And Tina Peterson, who is over our Kaleidoscope program. All of the services are free.
Okay, so now that you understand a little bit more about the plans for summer programs, if you can just take that third index card and respond to the question, are you planning to have your child attend summer program at Mary Ford, yes or no? And obviously, if not, if you have ideas of what your summer plans may be, that's just an optional if you have some thinking around that. I know early, just heard some information, but just want to get some preliminary ideas on where you're going for summer plans. Okay, the last question is to take out the last index card. And this is, we've heard some of the responses already that would be meaningful to you all, but the question that we have is how can the school or community partners such as Charleston Promise Neighborhood support your student and families next school year? So we talked a little bit about what worked this year, what could be better. Yes, ma'am.
There's a problem inside the classroom because it is really well this year, bringing my son to the front, but I need to get over that.
Eyes on here.
Yes, I see all of this, and I understand because of COVID, they can't, but they only walk along. By that time, he ought to no longer at the front, so he ought to calm down, whatever was wrong is going on. I need to do
I see other people nod your head. Is that similar to the estimate?
I got to see him, he got to see me like, the teachers do well, Ms. O'Connor, I'm trying to, they will call me on the phone, and I can have 5 minutes to 1 hour. My passenger on my car, they do this for my children. So I'm always in the area, so when they call, I'm here real quick. But I want them to be like, okay, Mom, it's coming, and then we see them doing themselves, doing their thing, so that I can understand where my teacher's frustration or my little boy is very at.
So I think if you're talking about really observation time in the classroom.
I don't want to be in the classroom,
But on the outside watching it.
She make it real good. Because my kid, she know easy, because she know Angel. She gives the teachers problems, but just if I can come to the school, when she acting like this, like she said, I'm pretty. Yeah, it is different. I mean, I get the reports after school. You do what you do at home, but while they still at school, you can just come down. Because I know if it wasn't for COVID, I would be here every other day. Y'all would know
Ms. Taylor, I need to be in the back, and next year I need to be able to go in the back and see you, I need to see my face when he's.
I missed something, I'm sorry.
Her question was, what could we do, what could we do next year to help us out, right? Like, Ms. Otaviano's been doing it, Ms. Catherine, they call me, they video call me and whatnot, when he's getting a little antsy inside the classroom, but it was something else when F7 ever acted up a couple of years ago. I was able to walk in her back and I can. But Louis is different, like when y'all walking up to the front, he ought to calm down, Mama's out front, but I need to catch him. I need to see him.
Yes,
I need to see him in action.
if you would come, if this weren't COVID,
Yes.
those classrooms down there have two-way mirrors, or one-way mirrors. You can walk in between and you can look at a classroom over here, look at a classroom over there. But that's okay. He's been fine. Everything is fine. They are children. We get children to act like children. So he's really doing great. You should hear him explaining all his lessons to me.
Yeah.
You should.
Okay, so a few more minutes. Thoughts on what other programs and supports that the school and other community partners can offer. Think about health and wellness in particular. We have a lot of investment planned for that next year. When you think of health and wellness, what comes to mind? We talked about creating opportunities for families to have a medical home, expanded services so that teachers, staff, you as a parent, other siblings can participate in a program here at the school. Dental visits, mental health, well, child checks, immunizations are all part of the things that we would be able to offer next year. So if those things are important to you, or other things in the health and wellness space, please take it and write those down. we heard about a request to have more activities for the children. Would you care to elaborate on an example of what kind of activities you're thinking about? You said highlighting and showcasing the talent of children, but what else comes to mind?
Parents, like she trying to say, get to the classroom, things like that, that's more what I'm at, because, my son has been here, we had new squad, Will King was, part-time, and so, and like she says, kids, they don't have that energy, they don't have that excitement, they feel like they can get over, they won't get over, you know what I'm saying, so, we have to take our time to be patient. My son was crazy not coming here. I came at 12 o'clock, came back 2 o'clock, he was just like that, So we got through that struggle. He's doing real good now. He's A's and B's now. No problems, keeps smelling, well mannered. And when it comes to parents, like I said, we got to have more activities with the kids. There's enough people right here to make a movement, a real movement. This is enough right here for the kids, yeah. So we got this type of energy going on, so it's like that. We're seeing like more activities coming from us along with the kids, beautiful from there. But being that this COVID situation, everything, it is, so we got to be patient with that too.
Right. Well, hopefully we'll see a little different structure next fall. Hopefully we'll still be doing some things, and we'll be talking about what the fall could look like with our special guest here. So anybody else want to share other ways that the school or community partners can support your family next year? Again, if you wrote things down, we'll collect those. And just to kind of recap, so just to recap what I brought in front of you here, I just want to make sure you can point things out. So we talked about school-based health. This is the program within USC. Again, you still have the opportunity to participate for another 6-7 weeks of the school year. Telehealth and in-person options are available to all. We also have the Community Engagement Council. This is Charleston Promise Neighbors Community Engagement Council. This is something of interest to you. If you're a resident, we love to hear resident voices around the table because it helps inform our work. We actually have a meeting coming up next Thursday in our outside patio of our office. And if you're interested, there's no need. There she is. She's getting to that. Please reach out to her. We would love to have you come and join us for actually on the patio and a little conversation about community engagement. We also have, for those parents, I know Ms. Taylor is talking about PTA, but this is another opportunity to Parent Advisory Council for Charleston Promise Neighborhood. This is a new initiative. As I mentioned, we've been around for 10 years, but we need more parent voices to help inform our work and our thinking. And so the more parents that can talk to us like this, the more ways that we can help identify ways that we can provide programming and support for the things we're talking about. So we need to hear more parents, and this is another space. Ms. Makita is in the back with the beautiful red glasses. If you want to talk about joining our Parent Advisory Council, please reach out to her. And I think we have identified everything that had on my list. Oh, please, one more thing. There should be a survey form on your table. As Ms. Wilson, our special guest, moves up this way, please take a minute to complete it. It just helps us understand who's participating in our summer programs, our after-school programs, our Kids Well School-Based Health Clinic, if you want to be in the Parent Advisory Council, have interest, or the Community Engagement Council. So just a quick yes, no to those 4 questions and your name if you want to give us information. We'd be much obliged to have it. And that's it. So thank you for listening. Thank you for sharing. Thank you for coming today. And I'm going to introduce you to a special guest. This is Dr. Ebony Hilton. And I'll let her do the introductions on her background and experience. She's also the author of this sweet little book called We're Going to Be Okay, which we did share with the school at the beginning of the year. You may have seen it, but we have more copies for you on your table, also in the corner there. So I'll let Dr. Hilton introduce herself, and thank you again for your time in Charleston Promise Neighborhood this morning.
Thank you all for having me. Can you hear me okay with this?
Yes.
And I'll try to be as brief as possible because I truly do want to open up for questions because I know in this pandemic there must be a lot of questions. So, my name is Stephanie Olson. I'm a clinical care anesthesiologist, which means that 30% of the time I spend covering the ICU and the 70% of the time I cover operations. So, brain surgery, delivering babies, you name it, I'm kind of all over the place. And I actually did all my training here at MUSC in Charleston. I was here for 18 years, but now I work at the University of Virginia in Charleston. So, I was actually brought here by Kelly with Charleston Stars, but we are the co-founders of Good Stop Consulting. And Good Stop, we basically, we're rooted in trying to understand racial health disparities. What is it that causes Black and brown people to have worse outcomes? Because we know that there's nothing wrong with us. Our children, there's nothing wrong with our kids and the way we're born. So what is it that causes us to have worse outcomes when it comes down to from delivering the babies, right, our diabetes, or even COVID? Why is it that our community gets hit the hardest? And then we come up with solutions to say, not anymore. How do we make sure that the future generations don't have to go through the same thing we're going through, right? Because what we know is that COVID-19 has uncovered a lot of heaviness, unfortunately, for Black people. You saw the news just like I saw the news, right? We know that Black and brown people are not only more likely to be infected, but we're also more likely to be hospitalized, and we're also more likely to, unfortunately, pass away from COVID-19. And just for a show of hands, does anyone in here know anyone who had to be hospitalized because of COVID? Okay. How many of us have unfortunately lost family members because of COVID? Right? So we all know someone who's either been sick or infected by this disease, and the question is, what do we do moving forward to protect ourselves even now, today, and moving forward to protect our children? And so I'm not sure what questions you may have, but literally there is no question I won't answer. So if you have them, come forward. But what we know at this point in the United States of America, unfortunately we have had the passing of now over 570,000 Americans. In South Carolina, at least, that's now 9,000 people. And we know that each person's life matters. And what we're seeing is that it's not only the people that have passed away, but we also have these, has anyone had anyone in their family who had COVID, but now they're still months later, still having some sign of symptoms? They can't breathe the same way, or they may notice that their legs are swelling up because their heart isn't beating in the same way. And it's not just older people. What we know is, unfortunately, for Black people in particular, we literally have higher death rates in every single age category. Although we said very early in the pandemic that children were safe, what we know is that Black children are 5 times more likely to be hospitalized from COVID. What we know is that although racial minority children, Black, brown children, they only make up about 48% of the population. There are 75% of the children who passed away from COVID-19. And what we're seeing here in South Carolina, over the course of the last 3 months, we're seeing an increased rate of what we call multi-system inflammatory syndrome. So children, luckily, they don't pass away as readily. But we are seeing that they are having some inflammation of their organs, their heart, their lungs, their kidneys are being inflamed. And the question is, what does that do to your developing body? When we have a little baby whose body hasn't fully formed, right? We know they're going to get older. We know that pancreas is going to work in different ways. What happens when that liver is actually caused to be in a state of fight or flight when you're 10 years old, and it shouldn't see that type of stressor until it's 40, 50 years old. And so that's why I find it very important to come and talk to parents to say, what questions do you have in the process of how to keep your family safe? And what questions do you have as it pertains to, if you have had the infection, what to do next, right? And then how do you prevent it from actually spreading throughout our families? I'm sure you all now have known about the COVID vaccines. I actually was the very first person at the University of Virginia to be vaccinated. And I actually had the Pfizer, Kelly had Moderna, other partner, I think she actually had Pfizer too. This other lady who just had Johnson & Johnson. These 3 things are out there and available, and I know there's tons of questions as it pertains to Black and brown people, particularly Black people, with vaccinations in the United States of America. We know the history, we know about the tea, we know about Flint, Michigan water supply, we know about things that happen currently. We don't have to go back to the 1970s to hear about the reasons of why we have distrust in the medical system. But at this day and age, I really want to make sure we're pushing forward the idea that we can hold the system accountable, that there are data and research that shows how this is working and functioning, how do we get that to the people that actually do it, so they can ask questions and truly hold our feet to the fire and make sure we're doing what's best. So I'll stop there for a second to see if there's any questions at all about anything.
Why don't you tell them how you became a doctor and where you come from?
Oh, yes. So I'm actually from Little Africa, South Carolina, which is in Spartanburg County. I was born in the middle of 3 girls, single parent home. And when I was about 8 years old, my little sister asked my mom if we could have a brother. I have 2 sisters. And my mom started crying, and she told us that actually my parents' first child was a little boy. She was 17 years old, and she went to a clinic to get, prenatal checks, as moms she felt good. And when she was 6 months and 2, they did some tests. She still can't describe what the test was, but she felt a sharp pain. She went home and she started noticing that her underwear were wet, and she called the clinic and said, "My underwear are wet. What is this?" And they said, "Oh, it's fine. You'll be okay." Later on that night, still more wetness. "What is this? You're gonna be okay." And unfortunately, she ended up going into labor. My brother lived for 3 days, and then he passed away. And so that was the first time I ever heard, I saw my mom crying. Like, this woman was, mom's in the room, dad too, but your mom is the strongest person you know. And at that time, I was only 8, and I did not know any doctors. But I thought to myself, something about this isn't right. And so how can I make a difference? And so, as odd as it sounds, because again, my parents, they didn't even graduate from high school. I had no clue what it was even like to go to college, but I knew at that point that I had to go and become a doctor, and I had no plan B. And so, growing up in medicine, what I found is that even to this day, my child, as a double board certified anesthesiologist, I literally had 13 years after high school training. Yet my child is twice as likely to die than a white woman with a 3rd grade education. Why is that? Right? And not to say there should be some type of 2-tier system, but clearly there is a 2-tier system. And we have to figure out what's the reasons why when Black and brown people walk into the hospital to get treatment, why is the treatment different? Right? But we deal a lot with this stuff and looking at what happens within our community, because we know that, healthy people don't go to the hospital. You don't go to the hospital because you're feeling great. You go to the hospital because you're sick. So what happens, health happens outside of the walls of the hospital. It happens where we live. It happens, where we work and play. So what about our communities is structured in a way that will lead us to be more sick? And for COVID, it's a beautiful example. How many people in here had to still go to work during COVID? You didn't do the Zoom calls. You weren't able to say, "Oh, well, the business is closed so we can stay home." Other people did, right? In fact, only 1 in every 5 Black people can actually work remotely from home. We are the persons that are the frontline people. We're the essential workers, and yet we're fighting to actually get a livable wage, right? So we don't have to work 2, 3 jobs. And when we're working all those jobs, we're putting ourselves into that environment and increase our risk of infection. And therefore, what we are trying to say now is, knowing that we have those things to battle now, how do we make sure that we are doing the proper things to keep us safe? Wearing our masks, social distancing, vaccinations, the whole 9. How do we make sure that the employers, too, are giving you tools that you can use to keep you and your family safe? Any other questions? Has anyone in here gotten vaccinated? Or does anyone have concerns about vaccine? But you want to stop the line? Okay, perfect. What's your
So my concern is, I'm cool with the vaccination, but I haven't gotten vaccinated. And to me, I feel like it's almost like politics, because basically you may feel one way or I feel another way. And then there's still people still popping up with COVID that have been vaccinated. So it's like,
Right, and so that's a very good question. So for one, politics did play a huge role in the vaccine rollout. For one, there was this idea that the vaccines came out really, really quick, and previous president made this warp speed. But actually, mRNA vaccines have been in the works for literally decades. If you go to Google right now, you can actually type in mRNA vaccine and cancer treatment. And the reason being is, and let me explain what, so does everyone know what mRNA vaccines are? Let's take that back. Okay, perfect. So, what mRNA vaccines are, if I can describe it in many analogies, that's the best way I feel like to get it across. So, mRNA, you think about a cake. You have different ingredients to make a cake. You have eggs, you have flour, you have milk, right? What the mRNA vaccine is, it codes, it tells your body how to produce basically just the egg. Just the egg that's going to go in your cake. You don't get the entire virus, you literally just get a coding for the code of the virus, right? And the code, the reason why that's important is that what we're trying to train your body to see is that if someone comes into your space and coughs into your face, if they have COVID and your body recognizes that this is the code of this virus and it's not supposed to be there, it can start attacking that virus to remove it from your system on day one. Because the reason being is that what typically happens, for people who had people in their family who had COVID, what you notice is that they were fine, no signs and symptoms until days later, right? In that days later, that it takes you to start actually getting treatment and help. The virus is able to go from just one virus in your body to 10 viruses, to 100 viruses, to 1 million viruses, and overwhelm your system, right? But if you had a vaccine and your body has been trained to say, as soon as you see this one virus enter into your system, and you recognize this code, start to remove it on day one. And that way your body, your immune system, your organs have a chance to actually fight this. So what you may notice too is when people get the vaccine, some of them say, and Kelly, you can maybe speak to what yours was, I had zero reaction. So when I say reaction, I have to be careful when I say that. People, you'll hear people say they have fevers and chills and muscle aches. Those reactions are literally your natural immune response to what you're supposed to do. So if you think about it, for people who love to go to the gym, right? If you're going to run a race or do some type of marathon, the thing that you do is you go to the gym to get your body to work out your muscles, right? And what do you feel like at the end of the day? Your muscles ache, you're sweating in the gym because your body has been through a workout process. The vaccine is supposed to do the same thing for your immune system. It is supposed to give you the battle plan that if someone comes into this room and coughs in your face, how do I make sure that I'm ready to fight this war immediately? And so the signs and symptoms that your body, your immune system is working is, what do you get when you get a typical cold? You get a fever. You get a body ache, you get muscle aches, you get really tired and sleepy because your body just wants to save all the energy that you possibly have to fight this battle. The same thing with the vaccine. Your immune system says, okay, I see that you're telling me to recognize this little coat. Okay, well then let me ramp up. Let me go ahead and fight off whatever it is maybe in my system. So again, on day 0, when you see people with COVID, like I have in my ICU, those persons, we are behind the 8 ball. If you end up in my ICU, literally at that point, what your body is already saying is that my heart no longer works for itself. My lungs no longer work for itself. My kidneys can't do it. Do you have a machine that can help me to try to get over this hump? And so we're hoping with vaccination that we can get you from having to be at that point. And what we're seeing is that people, when they're vaccinated, they don't have that overwhelming COVID-19 response. Now you will see people that can still get infected, and that's different, right? Because it's just like if you have an umbrella. If you go and jump into a pool of water, you're still going to get wet, right? The same thing with COVID, with the vaccine. It's not an umbrella to prevent COVID from ever entering into your body. You can still get infected, but what we hope is that once you get infected, instead of this virus being able to completely overwhelm your system, you can still be blocked, and so those people can still live. Because that's our ultimate goal, right? To keep families together. Because to tie it back, unfortunately, at this point, have 40,000 new orphans. Because people are dying at younger and younger ages, and parents are leaving behind their children. And we can't afford to do that. We know in Black and brown families, my grandmother helped raise me, because my mom had to work. We can't sacrifice our older, when they say, oh, it's just old people. They matter to us, right? So, and so in knowing that, it's one of these things of how do we address the concerns, because they're valid concerns. How do we make sure that we're listening to what the questions are and giving you answers that when you go home and you're thinking about it tonight, you can make the best decision for you and your family.
That is good. So, basically, I just want to educate y'all because what just happened to me. I took a COVID test at CVS, a rapid.
Okay.
And so someplace during this pandemic, and I had, must be COVID, and didn't know. And so I popped out positive with COVID, supposedly, like a week ago. But then I work at a facility that does swab tests. And so my manager told me to go the next day within 24 hours to take another test. That came up negative. Okay, so now, but in between that, this is the reason I'm at here for it now. Me and my family went slammed down. And so, because some were vaccinated and some are not, but that was my village, to help me with my children. So they felt a certain type of way. And I was just like, by Monday, well, by Tuesday, by the time I got my negative test, everything had untranspired. So it was just like a hot mess. But that's why I ended up here. But I just wanted y'all to know, now take COVID test and you pop up positive at a CVS for a rapid test, you might want to go and take another test that's a PCR test rather than a rapid, because if you have had COVID along the way and didn't know, it's going to pop up as a false positive. So basically, that's what I had to learn the hard way. So I'm trying to save anybody who go take a CVS or a pharmacy test or rapid test. Please go take another one within 24 hours so people can tell you whether you got COVID for real or not.
And it's one of those things, the tests I know have been very confusing, because the rapid test for there's antigen test, and then there's, an antigen is basically, a piece of the virus, like a shedding of a fragment of the virus, versus a PCR test is literally when you go on Maury and they run your DNA and they say you are a father, you're not the father, it's that type of thing, right? So with the test, why do they come up positive, why do they come up negative sometimes? It's just like coming with pregnancy tests, right? When you are first pregnant, your test might come out negative, right? You don't have enough of the hormone that you're actually urinating out that can be detected by that test. But it doesn't matter, because in 10 months you're still going to have a little baby coming out, right? You're still positive. You just may not have this test to be able to prove it. It's the same thing with COVID. What we know, again, in explaining how people, how the virus replicates itself. On that first day, if someone coughs into your face, the number of viruses that you have circulating in your body may be too low. It needs to multiply. So you may have been in a room with someone that says, oh, I'm positive, and you say, oh, well then I need to go get a test today. You go get a test, it comes back negative, right? 2 or 3 days later, you're starting to feel like, okay, something is going on, right? At that point, the viral load is what we call it, meaning that the virus has multiplied, it's gone from 1 to, let's say, just for the sake of argument, to 1 million in your body. Now you're positive. And if you wouldn't got a test, you would probably come out positive. But for the most part, most people, when they have that high viral load, are feeling sick, you want to stay in your bed, you don't feel like getting up and going to go take a test, right? And so you wait. And now you're on day 6 or 7, that now you're starting to come down, your symptoms are starting to come down, and you may say, okay, now I want to go get a test. But now, just like your symptoms are coming down, so is the viral load. So it can also come down and read as negative. So with these situations, what you'll see on the South Carolina EHAC website is that they have confirmed cases and then probable cases. The probable cases are those people who all the signs and symptoms of you are telling me you walk like a duck, you quack like a duck, you are a duck. Same thing with COVID, right?
Dr. Hilton, what do you think in terms of how folks should move with their families and their children Morning, everybody. The question is, what's Dr. Hilton's perspective on how we should be engaging now that more and more people have the vaccine in terms of crowds, churches are back in person, summertime, there's barbecues and lots of family gatherings. What are your recommendations for that?
Right, for sure. What I would say is, it's just like, you just stated, I think it was your question, that some of your family members have been vaccinated and others haven't, right? What we know in South Carolina is only 27%, I think, of South Carolinians have been vaccinated, at least has had, I think 40% has at least had one dose of the vaccine. So we know many people don't. In order to reach what we call herd immunity, we need at least 70% of the population to be vaccinated. So what I say, and y'all see me, I've been literally vaccinated since December 15th was my first shot, January 5th was my second shot, and I continuously walk around with the mask, and usually it's N95 mask, but continuously. Because what we know is that we do have increasing variants, right? We have the South African variant, you guys have heard of that probably, the UK variant, we've had variants out of California. So what we're saying is literally, until we get over this hump, and I do feel like we are getting closer. I know people are really tired, and that's why we wrote this book on we're going to be okay for the kids, because we know children don't have the capacity to be able to even say how they're feeling, right? But they're tired of being in the house, and I know you're tired of being in the house too. But until we get to that point of where we have that herd immunity, until we get to that point where our cases of our variants start to drop again, the safest thing for us to do is to, again, practice social distancing, wear your mask at all times, to truly make sure that if there's any question in your mind of, if I go to church, and I want to praise the Lord too, but I want to meet the Lord a little bit later, right? I want to meet him later. Because what we know is that in those closed spaces, there is a chance and a very high likelihood that someone in the room has COVID. And they're not trying to get anyone infected. No one wants to get anyone infected, right? But you can't look at a person and know. And so, until that comes across, keeping our children, making sure we know who our children are playing with. This school clearly is taking great precaution. I see hand sanitizer everywhere. And the spacing of the tables, and I hear about, how they're trying to keep you all engaged, because we know mental health is important, and the challenges of being isolated for this long is extreme. But again, if we do and we practice these things, then I'm hopeful that with the rate that we're vaccinating people, hopefully by the fall, we should be looking a little bit better. And if we think about it, that's not too long. Right? We can hold on. We've been through enough, and we can hold on for a couple more months, just to make sure that we all get to see 2022 together. That's the main thing. What other questions?
Now with the vaccine, most are put inside the hospital with COVID because of pre-existing health issues. I haven't heard enough studies or enough research has been done with those who may already have high blood pressure with the vaccine. There are those that already have asthma, bronchitis, anything that's already pre-existing. Like, there's not enough. That's where my worry is, because I got bronchitis in my house, high blood pressure, high cholesterol, generational, and like there's just not enough of what could or what would happen, even though my immune system might recognize this exactly what could it do to my heart or my liver or those who are already in that. Like, it's just not enough. How far is this study going with those who have pre-existing health issues?
Right, and very, very great question. With clinical trials traditionally in medicine, we literally say we don't want people with pre-existing conditions. We X them out. But this clinical trial with COVID-19, they literally actually sought out people with high blood pressure, with diabetes. We wanted to have those people because those are the people that were dying at higher rates, right? And so what you see with the Pfizer and Moderna, their clinical trials, literally they list out the people who have high blood pressure, who have diabetes, because specifically they were going after those persons. And another thing too with clinical trials, typically Black people are not in high numbers in these clinical trials. Traditionally, we maybe represent about 5% of people that participate in these research studies because again, we don't want to be guinea pigs. Completely understand that. But this time, in the Pfizer, I want to say the representation was 10%. Moderna, I want to say it was 12% of people, which is good because we make up 13% of the population. So we kind of match the number of the persons that were in the trial, which is fantastic. And then what I would also say is at this point, in the United States, we've had over close to 80 million people who have been vaccinated. And I guarantee you, they have high blood pressure, they have diabetes, they have if we look at the first persons in the phase 1A, they were nursing home residents. And we know as we get older, our body goes through changes and we are more likely to have these conditions. And so what we're seeing is that the elderly population, they've been vaccinated and they're actually doing better. The way the mRNA vaccine works is even more gentler than what we see with the flu vaccines for the elderly population. They're not having as much of the, just because of the way that the vaccine is kind of created, the vector for what is for basically the vector is the carrier that gets into your system is a little different. And so we're not seeing as many of the issues with older people with vaccination that we do with other vaccines. I'm not sure if anyone in here has had the shingles vaccine, but I heard that it hurts a little bit. Right. Worse than COVID. Right. And it brings up a very interesting point. Again, we talk a lot about the COVID, the deaths, but I have to urge people, in my ICU, what I see is some people that are actually living, but unfortunately the way their lives will be from here on out is completely different. For men in the room, if you look at University of Pennsylvania student athletes, what they saw was that for those with mild to asymptomatic cases, these are 19 and 20-year-old boys that are lifting weights every day. Barely had any signs of symptoms of COVID, but when they scanned their heart, they saw inflammation around their heart, 15 to 30%. If you look at the picture for the Boston Red Sox, Eduardo Rodriguez, I think his name is, 27 years old, had to sit out the season and was literally only cleared to walk in September. The incoming freshman quarterback of Georgia State, 18 years old, could not come to start because he had inflammation around his heart. And what we're seeing, unfortunately, with children, 30% of them end up developing these inflammatory processes. Again, my question is, what does that do to their bodies? And what we know is that right now, children can't get vaccinated. Now, we're now allowing 16 and up to be vaccinated in South Carolina. We're having clinical trials for 12 and up. But we know that kids are going to depend on us adults, to be that protective layer of organ, right? Just until we can get to the clinical trial that shows that it's safe for them. And that's the beautiful thing. I do appreciate what's happening with this vaccination rollout now. To be honest with you, I wasn't sure how I was going to feel about it in the previous administration because I felt like a lot of things were politicized, right? But we're seeing with this clinical trials and with the rollout is that if there's anything that's happening, if it looks like we need to go and stop and investigate, we do. Which is what happened with the Johnson & Johnson vaccine this past week. So how there was this incidence of 6 out of 6.8 million doses, 6 people had blood clots. Now, if we look at that, in comparison, that means 1 in every 1 million doses, there was a blood clot. If you're on birth control pill, ladies, for every 1 million women on birth control pills, about 1,000 of us will develop blood clots. If we're smoking, same thing. COVID-19, for every 6 people, 1 would develop a blood clot. So blood clots can be caused by many different things, but as soon as the vaccine and the FDA and the CDC saw that there was at least 6 people out of the 6 million that have been vaccinated, they said, let's wait. And that, for me, I think it boosted a boost of confidence that the system is working and being true, and saying, let's investigate, so that we can make sure that when we're saying which one should be for you, if there's risk factors that put you at risk of developing that, then instead of this one, we'll do this one. And that's the beautiful thing about having choices, right? So, any other questions?
Thank y'all for having me.
So this wraps up our parenting breakfast with Principal Taylor and CPA. But before we leave, we want to give out some prizes. So we have everybody's name at the top. Oh, nice, Ms. Nelson here. Call a name. Mary Britton. Hey, come to the Ollie, you want to explain the prize?
Here, I was gonna put you behind the camera.
We're going to hop over here to this one. Oh, have her close me. Tiffany Brown, come up and explain your prize. Yolanda McCullough. Come up and say your prize. Again, we want to thank you for coming out this morning and sacrificing your time.
Three more.
We have 3 more.
It's almost everybody.
I have Stephanie Brandt. Taylor Brandt. And last but not least, got one more. Yolanda Brown.
Almost everybody.
This concludes our parenting breakfast. We want to thank you again for coming out this morning and sacrificing your time. We do not take that lightly. We thank you as the parents. And we're looking forward to continue working with you next 2 years. If there's anything else you feel the rest of the thing.
I just want to thank Ms. Washington again and CPN for making this possible. And Dr. Hilton, I hung on every word you were saying. I'm so glad we have this recorded because the way you broke it down for us is how everybody needs to know what's happening with this. And we are so thankful. Kelly, thank you so much for helping this be possible. We are just very thrilled. So thank you. That's it.
Thank you.
Thank you guys. Have a great remainder of the day, and we look forward to having your involvement with the remainder of the year and next year. You're on our list for our parent involvement.